Good evening, everybody. This is Dr. Apoor Mehra, and we have the weekly session by Dr. Kavan Parikh here. He's going to talk about third prof part 1 subjects as a test and discussion today. Kavan has already discussed multiple times. Is a wonderful student. That's why a wonderful teacher. He is ready to learn, relearn, unlearn, and learn. And the way he explains the approach to questions, I wish I had the same when I was attempting the papers. And I think that it is important to study, but it's more important to attempt the paper. IPL is going on. We see fantastic lineup of all the teams. But as a team, do they perform the best? No. Look at Kings 11 Punjab. The top two scorers are top scorers of IPL. Even then, the team is not at the top. Same is the entrance exams. It is a composite of 19 subjects. Ignoring one can just pull you down. That's how you have to learn to practice questions, solve questions, learn the art, perform on that day, and finally, remember, don't leave a subject. It's all 19 together. True to all or none phenomena. Without taking any more time, I wish all the students all the best. Have a great time with the Dr. Kavan Parikh. Have a great day. Bye. Thank you very much.
Thank you, sir. Thank you for the generous introduction and good evening to all of you. Without taking much of the time, I hope you have attended the paper. You have solved the questions of PSM, ENT, and Opthal, which we are going to discuss today. So, here, before we start our discussion, the first thing which I want to reinforce again is PSM is a very, very important subject for entrance exam. And especially for Central Institute exams, we have chunk of topics, chunk of concepts in PSM which are relatively new and which are being tested in exams which we usually don't study in that much detail during our undergraduate level, right? We simply read from the Park's textbook and we try to mug up the things, right? But there are many conceptual areas, and I have told you in the previous session also that these are the conceptual areas where the examiners tend to rely for making questions, right? So let us change our mindset that PSM is a subject of cramming and PSM is a subject of factual information. Yes, it does have factual information, but that holds true for all 19 subjects. There is not a single subject where we don't have facts and things to be mugged up and learned by heart, right? But at the same time, let us not neglect the conceptual areas of preventive and social medicine, the practical aspects of preventive and social medicine. And that is why today, majority of the PSM questions, if you have attempted, I have tried to incorporate such areas which are more of practical significance, which are more of concepts rather than mugging up, right? Rather than factual information. Coming to the other two subjects, ENT and Opthal, with these two subjects, we are going to enter into the field of core clinical subjects, right? And with core clinical subjects, you should definitely expect all type of questions in case based manner in upcoming Central Institute exam, upcoming NEET, as well as in next exam, right? Because these subjects and these topics, they revolve around patients, right? So any and every topic of these subjects can come in a case based manner, so you should think of each and every topic of these subjects, these and the upcoming further subjects of final year, in a case based manner, right? It can come as a short case, it can come as a long case, It can come as an integrated case with pre and paraclinical subjects. So we have tried to incorporate all such different types of questions. And with this disclaimer, let us go to the first question, right? Which is per se of PSM subject, but I have tried to incorporate or integrate it with surgery, right? So what we are seeing here is there is a young female who was operated by an oncosurgeon for breast cancer, and on the follow-up advice, what the doctor recommends is screening for the BRCA1 gene to the patient's sister. So, what is the level of prevention which is being exemplified? So, this was a case based modification of the concept of prevention. So, we have different levels of prevention. We have four different levels of prevention which we study in PSM, that is primordial, primary, secondary, and tertiary. So the example which is being shown here, what does it exemplify? Basically, it exemplifies primary level of prevention. How? So for understanding how primary is the answer, you should know practically, you should know conceptually what is the meaning of all these four types of levels of prevention, right? All these four levels of prevention, what do they actually mean? So basically, what is primordial prevention? So primordial prevention is prevention of emergence of risk factors. It is prevention of emergence of risk factors, right? So we take measures for prevention which will prevent the risk factor of the disease to come, right? It will prevent the risk factor of the disease to come. So that is primordial prevention, right? So the best example which I can give you is, if you maintain the general health, right? If you maintain the general health of your body, right? If you eat nutritious food, if you get aware about your health, right? If you try to be in a state of good health, good physical and mental health, that is a type of primordial prevention. That is a type of primordial prevention, because by doing that you are avoiding all sort of risk factors which can likely cause the disease in future, right? So we don't even want the risk factors to be present. So that is primordial prevention. What is primary prevention? Primary prevention means the risk factor is likely to be present. The risk factor is likely to be present, but we are not allowing the risk factor to convert into the disease, right? We are not allowing the risk factor to promote the formation of disease or manifestation of disease. So that is primary prevention. And here we suspect, the oncosurgeon suspects that the patient's sister might have a BRCA1 gene mutation, right? She might have a BRCA1 gene mutation which can act as a risk factor for the development of breast cancer in future. So there is presence of risk factor, there is suspicion of presence of risk factor, and that is why the screening is advised for this risk factor, right? We want to identify the risk factor. We are not preventing the emergence of risk factor. Please remember, if BRCA1 mutation is there, it is going to be there in the patient's sister. Now we will not be able to prevent the mutation to happen. It has already happened, right? We just want to detect whether it is there or not. And if it is there, then we will advise the patient's sister accordingly to take further steps and to take care that the breast cancer does not develop. That is why this is an example. In secondary prevention, the disease the disease is there, right? The disease is likely to be there, but we want to stop, right? We want to stop the progression of the disease. We want to stop the progression of the disease. So that is what we are doing in secondary prevention, right? So screening for a disease is an example of secondary prevention, right? Screening for the disease is an example of secondary prevention, but here it is not screening for breast cancer, it is screening for the BRCA1 gene, which is a risk factor for breast cancer. That is why it is not secondary level of prevention as well, it is primary, right? So you might think that it might be primordial. You can think that it might be secondary as well if you focus on this word screening, but it is neither primordial nor secondary. It is a primary type of primary level of prevention which is being exemplified. And what is tertiary? Tertiary level of prevention means the disease has already progressed, right? But now we want to try to improve the lifestyle of the patient as much as possible. We want to try and improve the we want to try and reduce the complications, further complications, right, which the patient might suffer from. So rehabilitation is a very good example of tertiary level of prevention, right? So that is the different levels of prevention, right? So this is a pictorial representation of primordial, primary, secondary, and tertiary prevention. So screening and intervention, right? So early treatment, screening for a disease and early treatment of the disease are examples of secondary level of prevention, right? It is an example of secondary level of prevention, and rehabilitation is an example of tertiary level of prevention. Please remember, all majority of the national health programs act by the level by secondary level of prevention, right? They act by secondary level of prevention because majority of our national health programs, they are focusing upon the screening and early treatment of the disease. So they are acting by secondary prevention. Please remember this, right? So coming to the next question. So the next question is regarding the hypothesis testing, right? It is regarding the hypothesis testing, and there is again a case-based scenario where a hypothesis regarding a possible relationship between the WhatsApp chatting and the social isolation was being tested, right? Randomized control trial concluded that there is no correlation between the two variables, whereas in reality, worldwide psychological surveys have proved an association, right? The findings of RCT can be best described as the options are power, confidence, alpha error, and beta error. Now, this might be a new concept for you, which you might not have studied during your MBBS exam when you are reading Park, right? So basically, in a hypothesis testing, first of all, whenever any such case is there, what you have to see is what are the findings of RCT and what are the findings in reality, right? This is the first thing which you will try to see. Second thing you will try to see is what is the hypothesis, right? So first of all, the step now you have to go step by step. Step number 1 is creating a null hypothesis, right? So you have to establish a null hypothesis. Now what is a null hypothesis? Null hypothesis means you are saying that there is no correlation between the two variables. That is null. Null means no or zero, right? So null hypothesis means there is no correlation between the two variables whichever you are discussing. In our case, there is no correlation between WhatsApp chatting and social isolation. That is our null hypothesis, right? That is our null hypothesis defined as HO, right? Now what our RCT is telling? Yes, our RCT is telling that there is no correlation. So our RCT favors the null hypothesis. Our ICT favors the null hypothesis, whereas the reality is opposite, right? The reality is opposite. The reality opposes the null hypothesis, right? So this is what we infer from the question. This is what we infer from the question. This is the first thing which we have to do. We have to define a null hypothesis and see that out of RCT and the reality, which one favors and which one opposes the null hypothesis, right? Then comes, so this is the first step, formulation of null hypothesis. Second step is making a 2 by 2 table, right? It is making a 2 by 2 table. Now in this 2 by 2 table, what you have to do is you have to fill this information. You have to fill this information in the 2 by 2 table. So there is an RCT and there is reality. So in reality, the null hypothesis is false, right? It is false in our case. right? Whereas in RCT, the null hypothesis was accepted. The null hypothesis was accepted. So what is the confluence? The confluence is, it is a type 2 error or a beta error or a false negative error, right? So type 1, type 2 is just the convention. Again, alpha beta is just the convention. False positive and false negative is what you can define logically, right? So our null hypothesis, which was accepted by the RCT, it says that there is no correlation, whereas actually there is an association, right? So our RCT is defining a false negative finding. It is concluding a false negative finding, right? So that is what we can logically infer from our discussion, right? That in reality there was an association, but our trial is saying that there is no association. So our trial has given a negative finding, but this is a false negative finding, right? This is not a true negative finding. That is why it is known as type 2 error or a beta error, right? So if you are having a false negative finding, it is beta error. If you are having a false positive finding, then it is an alpha error, right? On the other hand, if in reality the null hypothesis is false and it is rejected by our RCT, then it is known as power, right? And if null hypothesis is true and it is accepted by our RCT simultaneously, then it is known as confidence, right? It is known as confidence. So what is confidence? Confidence is true positive, right? And power is true negative. False positive, false negative, we have already defined, right? So step 3 is nothing. You have to place the findings in the table, right? In our case, what is seen in reality, null hypothesis is false. Null hypothesis is false because there is an association, right? But according to RCT, null hypothesis was accepted. So this is a type of beta error or a false negative error. So this is the table of difference between type 1 and type 2 error. This is the verbal description. Null hypothesis is true but rejected. That is type 1 error. Null hypothesis is false but accepted. This is type 2 error. I have given it in this form because they can simply make a sentence based question and they can ask you the same thing instead of giving it in a case based manner, right? Also known as alpha error. This type 2 is known as beta error. What is type 1 error? Actually, it is the probability of concluding the treatments differ when in reality they don't, right? So when this RCT is conducted in terms of treatment, in terms of comparison of two treatments, right? Then what will this alpha error suggest? This alpha error will suggest the probability that the two treatments are different and the new treatment under trial is significantly better, right? When in reality actually does not happen, right? So the very simple example of this is, for example, there is a pharma company, right? See, in PSM, whenever you are learning the concepts of biostatistics or epidemiology, try to set an example in your mind and learn, right? That will make the things easy rather than uh, getting confused in the myriad of words, right? So let us take the simple example. There is a pharma company who is making a new drug, right? Or who is making a Me Too drug. And now this pharma company is conducting the randomized control trial, right? To prove the efficacy of the drug. So this pharma company will deliberately try to commit the alpha error. They will deliberately try to commit the alpha error because they want to prove that their drug is better, the new product is better compared to the older one, where in reality it would not be there, it would not be the scenario. In reality the drug might not be significantly better, but the pharma company will try to create an alpha error and the pharma company will try to prove that the new drug is better, right? So that is regarding alpha error. In the same scenario, what is beta error? So for example, there is an RCT for defining the adverse drug reaction of a new drug, right? So a pharma company is conducting a trial to define the ADR to see whether there is significant adverse drug reaction of a new drug. So in this scenario, the pharma company will try to deliberately create a beta error. The pharma company will deliberately try to show that the drug is not producing any ADR where actually it is going to produce, right? In reality, the drug is producing the side effect, but the RCT of the pharma company will try to show that there is no side effect, right? So they are producing a false negative impression, that is beta error. And in this case, when they want to prove efficacy, they will try to create a false positive impression or alpha error, right? So alpha error is not affected by the sample size, whereas beta error depends on the sample size. Alpha error is a more serious error, whereas type 2 or beta error is less serious. Type 1 error is for statistical significance, whereas type 2 error is for the power of a test, right? Because it rules out the negative findings more specifically.